viewers, welcome to Speed TV. It is a pleasure to introduce to all of you Dr. Sunil Kota, eminent endocrinologist from Berhampur. He is going to talk to you about the keto diet today. Hello Dr. Sunil, my first question to you, what is the keto diet?
So before going on to the topic, let me introduce my friend as well. He is Dr.V Sri Nagesh, eminent endocrinologist from Hyderabad, and he is one of the executive board member of the Endocrine Society of India as well.
Thanks a lot. Too much of eminence around.
Yeah.
So, coming to the crux of the issue, your take on the keto diet. What exactly do you think is the keto diet?
Yeah, actually, when we talk about management of obesity, the major thrust is on diet restriction, which contributes to 70% of the chances. And in the process of weight loss, there are some diets which offer us slow weight reduction, slow and sustained, and there are some extreme weight reducing diets. Out of those, keto diet is one such, where the carbohydrates are restricted to bare minimum, and different studies project it at 5 to 10%, and the predominant chunk of diet comes from the fat, contributing to around 70 to 75%, and the rest amount goes for fat. So it is a form of diet where the carbohydrates are at bare minimum and the fats take the upper hand.
What do you think is its mechanism of weight reduction? How does it reduce weight?
Yeah, the mechanisms are manifold, but the initial phases, the predominant mode of weight loss is water loss or diuresis, because amongst three macronutrients, carbohydrate is the one which holds on to water for a very long period, and when the carbohydrates are reduced, there is a sort of diuretic effect. So initial weight loss is due to water diuresis, and then comes the lipolysis. There is reduction in lipogenesis. At the same time, there is a satiety effect of protein, so that the patients won't feel hunger after taking such a diet, and there is thermic effect of protein as well, which comes into the picture.
So what is your take on the current literature in obesity? Do you think it supports keto diet, or it is on the whole against keto diet?
Yeah, so there are studies supporting both the ways. Like, there are some studies which say it is really beneficial in terms of weight loss, and some studies which talk us about the better control of A1C with better control of weight and other parameters like lipids, blood pressure and all. But there are counter views as well. There are different schools of thought which say probably it is not the fact. But as of now, looking at the entire set of literature, I can say for short term weight loss, the current literature published in 2019, the lipid journal, it states that probably up to a period of 12 to 13 months usage, it can be definitely recommended, but it cannot be used for very long term, because most of these studies are less than 2 years duration, and there are a number of other pleiotropic benefits, but again, there are different schools of thought. Some say it increases lipids, some say it reduces lipids, but as of now, for short term weight loss, definitely it is one of the good options.
What are the side effects of this keto diet?
Yeah, this is one very important aspect which we need to talk about, because there are some short term side effects and there are some long term side effects as well, which hampers its adherence and sustainability. The short term side effects include constipation, halitosis, weakness, muscle cramps, then sometimes there can be potentiation of DKA, keto rash, keto flu. These are some of the short term side effects. The long term, because of there is calciuria, there would be bone loss, there would be excess formation of uric acid, which can give rise to kidney stone formation as well. There are chances of hypoproteinemia as well, because of association with protein losing gastroenteropathy, and there are chances of renal involvement in the form of acute kidney injury, which can be due to dehydration, and at the same time there are chances of increased occurrence of mortality because of the increased intake of animal protein. So these are and on top of this, there are chances of vitamin and mineral deficiency, which can also be playing a significant role in its lack of sustainability results.
So what is your final take home message about the keto diet? Should we do it or should we not do it?
Yeah, so I was a part of the debate, so I would definitely tell that as of now, from a neutral point of view, for short term weight loss, definitely it is of use. So probably the current lipid guidelines also suggest use it for a period of 12 to 13 months, give a break, come to a dietary pattern where there would be restriction of calories and there would be reduction in the portion size, and again after some period of time you can go back to keto. But as of now, because of lack of long term data, because of the short term and the long term side effects, it would not be my first choice, as supported by the several guidelines as well.
So thanks a lot for a very lucid explanation about the keto diet.